Back to our channel. Now we are going to start fibula anatomy. So fibula, if you see, it's a lateral and small bone of the leg. So medial bone is our tibia and the lateral bone is our fibula in our leg, and it is very thin as compared to the tibia, and it is homologous with ulna of upper limb, whereas tibia is homologous with the radius of upper limb. So our ulna is homologous with this fibula. Now let us understand the side determination. So this bone is also divided into upper end, shaft and lower end. So if you see the upper end or the head, it is this, you can see this mentioned head of the fibula. The upper end or head is slightly expanded in all directions. If you say it is expanded in all directions, and the lower end or the lateral malleosus, it is mentioned here, lower end or lateral malleosus is expanded anterior posteriorly, and it is flattened from side to side. If you see the lower end, it is flattened from side to side and expanded anterior posteriorly. So you can see this is a ventral view, this is the dorsal view. Even in the dorsal view it is expanded, right? So anterior posteriorly it is expanded and flattened side to side. See, this side flattened, this side flattened, even in this side. Okay, so next, coming to the medial side of the lower end. So the medial side of the lower end bears a triangular articular surface. This is the medial side because this is the lateral side on the lateral malleosus. So medial side will have a lower and medial side have triangular articular facet anteriorly and a deep malleolar fossa posteriorly. So posteriorly, if you see here, you can see the deep malleolar fossa. So there is a groove for fibular tendons. This is a lateral malleosus. So on posterior side malleus, you will see a fossa, deep malleolar fossa posteriorly. Okay, and the medial side lower end bears a triangular articular facet anteriorly. This one. Now let us start the general features. So first, upper end or head. So if you see the upper end or head, it's slightly expanded in all directions, and the superior surface bears a circular articular facet. Superior here, circular articular facet, which mainly articulates with the lateral condyle of tibia. In the tibia, the lateral condyle articulates here with the superior surface of head of upper end of ulna. Sorry, not ulna, fibula. Okay, so next, coming to the apex of head or the styloid process project upwards from posterior lateral aspect. So here you can see, you can appreciate this is a styloid process on posterior lateral aspects, right? Here, even here you can see it more clearly. This is the styloid process. So remember, in the case of fibula, the styloid process is present on the upper end. Okay, this is the main thing to remember, that is at the head side, at the apex, you have the styloid process which projects upward from the posterior lateral aspect. Posterior and lateral, you can see here, posterior lateral aspect. Next, coming to the constriction, immediately below you can see there is a constriction, and the head is known as neck of fibula. This is important. The head is known as neck of fibula because you can see this is the head of the fibula. On the apex of head of fibula you have styloid process, and below you have the neck of fibula. Now coming to the shaft shows considerable variation in the form because it is molded by muscles. So because of muscles molding on it, neck has constriction, but again here it has some different structure because of different muscles which are molding it. It has mainly three borders, that is the anterior border. So to understand the anterior border, we need to see on the lateral side you have a triangular area. So that triangular area, mainly by means of that triangular area, you can predict the anterior border. So if you see this one, this is the anterior border. This one is the anterior border of the fibula. Okay, so next border is posterior border. Of course it will be on back side. This one is a posterior border. You can see this one, this is a posterior border. Okay, and next comes the introitious or medial border. This is the introitious or medial border. So just beside the anterior border only you'll have the introitious or medial border. Okay, this one is introitious or medial. And next you have the three surfaces. So very easy to remember, three borders, three surfaces. So we have discussed the three borders: anterior border, medial border, posterior border. What are the three surfaces? Of course you have your first one, medial surface. You can see the medial surface is just between the anterior border and the medial border. You have the medial surface. Okay, and next coming to the lateral surface. The lateral surface is just between the anterior border and posterior border. Okay, and next you have the posterior surface. Of course the posterior surface is between the posterior border and this is the lateral border, right? So this is the posterior surface. So 3 borders, 3 surfaces. Now let us look at each border in detail. First, coming to anterior border, it begins just below the anterior aspect of head. So just below the anterior aspect of head begins the anterior border here, okay. And at its lower end it divides into enclosed and elongated triangular area. So this one, it will come like this, and here it forms this side. On the lateral side it will form a triangular area like this, okay. So this is the triangular area on the lower end, which is continuous with the lateral surface of lateral malleosus. This is lateral malleosus, so it is continuous with lateral side of lateral malleosus, okay. Next we'll see the posterior border. You can see this is a sharp posterior border. This posterior border is rounded in its upper end, lies in line with the styloid process. You can see it is in line along with the styloid process. Below the border continues with the medial margin of the groove on back of lateral malleosus. So it continues on back of lateral malleosus. This is lateral malleosus, on its back it continues like this. This is the posterior border, okay. Next, coming to intraosseous or medial border. Of course this is intraosseous or medial border, right. This lies just medial to anterior border, just, okay, but on more posterior plane it terminates below the upper end of rougher area above talar facet of lateral malleosus. So it ends above the talar facet here of the lateral malleosus, okay. And in its upper 2/3 the intraosseous border is lying very close to anterior border. In the upper 2/3, if you see, the anterior border and the medial border are almost like very close. You can see very small gap between them. So anterior and medial border are very close in the upper 2/3. The intraosseous border lies very close to anterior border and may be indistinguishable from it. Yes, they are indistinguishable in the starting. You can see the anterior border and the medial border. They are like very close, in very close proximity in the upper 1/3. One correction regarding the posterior surface. Actually this posterior surface is between the posterior border and the medial border, not lateral border. Before I mentioned lateral body, sorry. Posterior surface is mainly between the posterior border and the medial border, okay. And one more thing, that the posterior border is divided in its upper 2/3 into two parts, mainly by a vertical ridge that is called as medial crest. So you can see this is the posterior surface in the upper part, mainly the posterior surface in the upper part. Here you can see mainly this one. This is the vertical ridge here comes, which is called as medial crest, which divides the posterior surface in turn into two parts, okay. Now coming to lower end or lateral malleosus, let us discuss about this part mainly. This is lateral malleosus. This is on anterior side view. This is the dorsal side view, and you can see this is the medial view. Mainly in the medial view, if you see, there is an articular surface of lateral malleosus and there is a fossa of lateral malleosus, right. So fossa of lateral malleosus is present posteriorly. Anteriorly you have the articular surface of lateral malleosus. So now let us discuss about lower end. The tip of lateral malleosus is just 0.5 centimeters lower than that of medial malleosus, and its anterior surface is 1.5 centimeters posterior to that of medial malleosus. It has following four surfaces. It has anterior surface, which is rough rounded, okay. In the posterior surface, you can see it is mainly marked by a groove, and it has a lateral surface. You can see the lateral surface. Of course this side will be the lateral surface, sorry, this side. You can see it's mentioned here, this is the lateral surface. The lateral surface is subcutaneous. And next, coming to medial surface, bears a triangular articular surface like this one. Medial surface have triangular articular facet for talus anteriorly, okay. It has a talus for talus anteriorly and malleolar fossa posteriorly, this one. So by this we completed all the bony features of fibula. In the next part we'll discuss about the attachments and relations of fibula.